Hi everybody. So one of the most common questions I get asked by patients and their parents is that which type of expander is the best? Should we use a normal expander, which is tooth-borne, or an expander that is anchored onto the teeth, or should we use an expander that is anchored directly into the bone, which we call a bone-borne expander? In that case, we have to use some mini screws or small studs that have to go in the palate to anchor the expander directly in the palate. Or we can use a hybrid design where the expander can be anchored partly onto the teeth, and then in the front part it can be anchored directly into the bone, and this will be usually done with 2 screws in the front. And I have to say the answer to this, it depends. First, it depends on the age of the patient. For example, if the patient is young, then we don't need to use any screws to anchor the expander in the palate. We can just anchor the expander onto the teeth. And the common appliance for this is called RPE, or tooth-borne RPE. If the child is over the age of 12 or 13, this is when the suture of the palate starts to get a little bit denser. And in those scenarios, it can be a little bit more effective to anchor the tooth or to anchor the expander not only into the palate or not only onto the teeth, but also directly into the palate. And this is usually done by 2 screws in the front. But sometimes when the patient is older than, let's say, 14, 15 or 16, or older into their 20s or sometimes into their 30s, the preference then is to use a device or an expander that is mainly anchored into the bone, if possible, and not include the teeth in the expander. And the reason being is, when we expand, we want the expansion to mainly happen in the bone or in the palate. We don't really want the teeth to tip out. We want the bone or the palate to split and to open. And in order to do this, it is better to isolate the teeth and just keep the expander anchored directly into the bone. Now, to do this, we usually need 4 screws, 2 in the front and 2 in the back. Sometimes it is impossible to place the screws in the back if the bone quality is poor. Then we have to accept that, and then we can just do a hybrid design where the expander will have 2 screws in the front and it will be anchored on the teeth in the back. So the bottom line is, there is no single type of expander that will work on every patient. We have to tailor this based on your age and based on your expansion needs.